Imagine waking up one morning feeling perfectly fine, only to learn years later that your liver had been silently failing all along. For thousands every year, this is not a hypothetical scenario but a tragic reality. Liver disease often creeps in without warning, showing no obvious signs until it is too late. But now, a groundbreaking new tool is changing the game, offering a simple, accessible way to peer into the future and catch this stealthy condition before it takes hold. This innovation is called the Cirrhosis Outcome Risk Estimator, or CORE for short. At its heart, it is a digital calculator designed to predict the likelihood of someone developing severe liver disease within the next 10 years. What makes it remarkable is not just its accuracy, but its simplicity. All it needs are a few basic pieces of information, results from a standard blood test that measures liver enzymes, along with the person's age and sex. No complicated scans, no invasive procedures, just data that is already routinely collected in most doctor visits. The science behind CORE is rooted in years of research, drawing on large-scale health data from diverse populations. By analyzing patterns in how liver enzymes behave over time in people who later developed serious liver conditions, researchers were able to build a model that spots subtle warning signs long before symptoms appear. In tests, the tool correctly identified who would go on to develop severe disease and who would remain healthy in the vast majority of cases. That kind of foresight is rare in medicine, especially for a condition as quiet and deceptive as liver disease. Why does this matter so much? Because liver disease is a silent epidemic. Unlike a broken bone or a fever, liver damage does not announce itself with pain or obvious discomfort in its early stages. People can feel completely normal while their liver slowly deteriorates due to factors like long-term alcohol use, fatty liver from poor diet and lack of exercise, or undiagnosed viral infections. By the time jaundice, fatigue, or abdominal swelling show up, the damage is often advanced, and sometimes irreversible. The consequences are severe. Every year, tens of thousands lose their lives to liver failure, many of them in the prime of life. What makes this even more heartbreaking is that most of these cases could have been prevented. Early detection opens the door to lifestyle changes, cutting back on alcohol, improving nutrition, increasing physical activity, that can halt or even reverse early liver damage. In some cases, timely medical treatment can stop the disease in its tracks. But without a way to identify those at risk early on, these opportunities are missed. This is where CORE steps in. Think of it as a kind of early warning system for your liver. A doctor could run the numbers during a routine checkup and, if the risk score is high, initiate a conversation about prevention. For someone who has been drinking heavily for years but feels fine, seeing a high-risk result might be the wake-up call they need. For another person carrying extra weight and unaware of the strain on their liver, it could motivate a shift toward healthier habits. Knowledge, in this case, truly is power. What sets CORE apart from other risk calculators is its balance of precision and practicality. Many predictive tools in medicine rely on complex algorithms or require specialized tests that are not widely available. CORE, by contrast, uses information that is already part of standard healthcare in most countries. That means it can be rolled out quickly and affordably, without waiting for new infrastructure or expensive equipment. It is designed not just for specialists in big city hospitals, but for general practitioners in small towns and community clinics, places where early intervention can have the biggest impact. Already, the calculator is available online, free for anyone to use. Medical professionals can plug in patient data and get an instant risk assessment. But even members of the public can try it themselves, using recent blood test results. This openness is intentional. The creators believe that empowering individuals with knowledge about their own health leads to better outcomes. When people understand their personal risk, they are more likely to take action, whether that means scheduling a follow-up test, talking to a doctor, or making changes at home. Of course, no tool is perfect. CORE is not a diagnosis, nor does it replace clinical judgment. A high score does not mean someone will definitely develop liver disease, just as a low score does not guarantee immunity. But it does provide a valuable starting point for conversation and further investigation. Used wisely, it can help prioritize who might benefit most from closer monitoring or preventive strategies. The broader implications of this kind of technology are profound. As medicine moves toward more personalized and preventive care, tools like CORE represent the future. Instead of waiting for illness to strike, we can begin to anticipate it, and act before it's too late. This shift could ease the burden on healthcare systems, reduce hospitalizations, and most importantly, save lives. Consider the ripple effect. If even a fraction of at-risk individuals receive an early warning and make modest lifestyle changes, the number of advanced liver disease cases could drop dramatically over the next decade. Fewer people would need transplants, fewer families would face the heartbreak of losing a loved one to a preventable illness, and more people would live longer, healthier lives. That is the promise of early detection. Moreover, CORE could help address health inequities. Liver disease does not affect everyone equally. Certain communities, often those with less access to regular health care, bear a heavier burden. By making risk assessments simple and widely available, CORE has the potential to reach people who might otherwise fall through the cracks. A free online tool requires only internet access, which is increasingly common even in underserved areas. Combined with public health campaigns, it could become a powerful equalizer. Still, challenges remain. Not everyone gets regular blood tests, especially if they feel healthy. Encouraging routine screening, particularly among those with known risk factors like obesity or heavy alcohol use, will be essential. Doctors will need training to interpret results and counsel patients effectively. And public awareness must grow so that people understand why liver health matters, even when they feel fine. But the foundation is now in place. With a tool that is accurate, easy to use, and grounded in real-world data, the path forward is clearer than ever. The next step is integration. Bringing CORE into standard medical practice, embedding it in electronic health records, and making it a routine part of preventive care. Pilot programs in clinics could demonstrate its real-world impact, paving the way for wider adoption. In a world where so many diseases are detected too late, CORE offers a rare glimmer of hope. It turns the invisible into the visible, the uncertain into the actionable. It reminds us that sometimes, the most powerful medical advances are not flashy new drugs or high-tech machines, but smart, simple tools that put knowledge directly into the hands of those who need it most. Liver disease may be silent, but thanks to innovations like CORE, it no longer has to be a surprise. With the right information at the right time, ordinary people can take control of their health before it is too late. And that is a future worth working toward. One blood test, one conversation, one life at a time. If this gave you a new perspective on your health, or someone you care about, hit that like button, share it with a friend, and subscribe for more stories that turn complex science into real-life impact. Your liver might not speak up, but now you've got a tool that can. Stay informed, stay proactive, and take care of yourself, because prevention always beats a cure.